Good afternoon, folks. This is Rob Chappell, Executive Editor of Madison365 with your daily update for Wednesday, November 3rd. The update today brought to you by Forward Theater Company, presenting The Amateurs by Jordan Harrison. This time-traveling comedy features a troupe of 14th century actors performing Bible stories while outrunning the Black Plague. That sounds hilarious, which it doesn't sound like a comedy logline, actually, but it is. It's inventive and hilarious. And the Amateurs considers the purpose of art in dark times. It runs November 4th. It's tomorrow night it opens through November 21st. Tickets now available at forwardtheater.org. And we appreciate their support of the update. We're going to talk through some real quick numbers, but the main thing we want to talk about today is the vaccines. Now, you could, in theory, your kids can get vaccinated right now if they're between the ages of 5 and 11. So I spoke earlier this afternoon. I spoke with Dr. Hmong Kharbat, who's the Vice President of Pharmacy Services at SSM Health, about the vaccine, what it means, what the side effects are, how you can get your kids vaccinated, why you should get your kids vaccinated, all that stuff. We'll get to that in just a moment. But first, I just want to talk through some numbers real quick. Not a lot to talk about because the news is actually pretty good today. It's better than it has. We were going down. Then we're kind of leveled off, and we're kind of going up the last couple of days. I didn't like that. I expressed that to you yesterday. I didn't like the way it was going. It's coming back down, though. Yesterday, it was like 1,920 something on average, 7-day average for new cases. Today, it's down to 1,888. So not a huge drop, but at least it's not going up. That's including 1,334 new cases today, which is a lower number than we've seen in the last few Wednesdays. Okay. The positive test rate is still at 8.0, which I don't like. That's still too high. That's the same as it was yesterday. I would rather that come down, so I don't love that. But I think there's still some negative tests that haven't been processed. So that might actually be revised downward. The daily average of deaths, this is the best news of the day probably, is down to 8. Only one new confirmed death yesterday. Now, again, these are deaths that took place a month or two ago. Okay. But if we're at the point of we're already getting caught up with reporting and confirming deaths, that means we didn't have nearly the number of deaths that we thought. I honestly thought 3 months ago, as things were going really bad in September, I honestly thought that by now we'd be over 20 or 30 deaths a day, and we never got higher than 17. So that's probably the best news of the day. Again, 8 new deaths being confirmed daily at this moment. Hospitalizations also down today, a little bit down. Basically, hospitalizations have kind of leveled off. It kind of came back up a little bit yesterday. 928 people currently hospitalized, 268 people in ICUs. 928 is only one fewer than yesterday, 29 higher than a week ago, but still, pretty level. ICUs across the state, though, are still like 95% full. So that's not really great. But again, the COVID hospitalizations are coming down, which allows for hospitals to take care of other procedures, which then, like heart surgeries and stuff, which then also require a brief stay in ICU. So it is decent news on the hospitalization front. So we're going to get now to our conversation with Dr. Kharbat. Again, he's the Vice President of Pharmacy Services at SSM Health. If anybody knows a thing or two about vaccines, it'll be him. So here's that conversation. Today, Dr. Hmong Kharbat, who is the Vice President of Pharmacy Services at SSM Health, to talk to us about childhood vaccines. Dr. Kharbat, how you doing?
Doing well. Thank you for having me.
Good. Thanks for being here. I really appreciate a lot happening in the world of vaccines right now. And we know that the FDA, this is my understanding, you correct me if I'm wrong, the FDA has given emergency use authorization for the Pfizer vaccine for children ages 5 to 11. And then subsequently, the Center for Disease Control and Prevention has authorized the deployments or whatever it is they do. Can you tell us, we've learned a lot about what those things mean, but can you just summarize for us what an emergency use authorization is? And does that mean it's safe and effective and everybody should go ahead and get their kids vaccinated?
Yeah, definitely. At the conclusion of a clinical trial that Pfizer has been conducting on kids 5 to 11 and the use of the COVID vaccine in this age group to demonstrate safety and efficacy, Pfizer requested an emergency use authorization from the FDA. The FDA reviewed the data, and their advisory panel, the Vaccines and Related Biologic Products Advisory Committee, met and issued their recommendations in favor of supporting the vaccine for this age group. Then the FDA issued an emergency use authorization. The difference between an emergency use authorization and a biologics license, which is a full approval, is that it takes less time to do the emergency use authorization, and the number of people enrolled in a clinical trial typically is lower. So there are differences between an emergency use authorization that we need to tackle an emergency compared to a full review. But that doesn't mean that the product is any less safe or effective. After that, as it is with every vaccine, the CDC will have to review the data, and they did. So their advisory panel, the Advisory Committee on Immunization Practices, reviewed the data, issued the recommendations again in support of the vaccine. And finally, at the conclusion of all of this, the CDC's director issued her formal guidance last night.
So it's good to go, right? I mean, and there was some talk that the government and the states had already put in motion to get the actual vaccines into the hands of the pharmacies and the healthcare providers. Is that true?
That's correct. They arrived yesterday, and another shipment arrived today, so we have the vaccine.
Great, so we're ready to go. Now, this is an mRNA vaccine, right? Which we've heard a lot of that too this year. Can you just explain a little bit how that works? And so if I'm giving my vaccine to my child, how does that actually work in my child?
Yes, some vaccines are created by actually including in the vaccine itself fragments of the virus itself. So we introduce it to the body recognizes this as foreign material and issues or produces an immune response against it. In the case of the mRNA vaccine, what's different is that what we put in the vaccine is a genetic code, an mRNA code, that goes inside the body. The body interprets the code and produces the viral protein that then triggers the immune response. So it's different in the design of the vaccine, but the outcome is similar. In both cases, you basically stimulate the immune system to respond.
And I'm correct in saying that just to say that it's an mRNA vaccine or a genetic vaccine, it does not affect your DNA or your genetics and anything like that, right?
Not at all. It does not. And all it does, it helps us produce the viral spike protein.
Got it. Now, what about side effects in children? I got my vaccine. I got my booster earlier this week, and I felt just kind of really tired for a day. Have we seen similar side effects in kids? And should we plan on keeping our kids out of school for a day after getting the shot, maybe?
A very similar safety profile seen in kids is what we saw with adults. Most people will experience mild side effects such as injection site irritation, pain. Some people may experience a high temperature or headache, but these effects last for 24 to 48 hours and they resolve on their own.
So some kids might feel not quite up to going to school the next day, but we'll be fine.
Exactly.
For the most part. So now, considering this is being rolled out already, what should parents who want to get vaccines for their kids do right now? Should we be calling our healthcare providers? Should we be talking to our schools? How do we go about this?
Well, they will have plenty of options. So they can call their pediatrician's office, and in the case of SSM Health, we offer the vaccine through our pediatrician's offices, and they are welcome to bring their kids there. Our scheduling lines and electronic options will be available very, very soon. They may also be in an area where the school is offering the vaccine on site, and their kids may get vaccinated at the school. In some other areas, pharmacies may offer the vaccine. So there will be plenty of options in the community.
Do you anticipate any access issues? I know we had, underprivileged and marginalized communities have had difficulty getting a hold of vaccine, for adults. Do you anticipate similar issues with the kids' vaccines, and how do we, as a community, try to get over those?
Yeah, unlike with the initial rollout, when the vaccine was rolled out initially for people 16 and up, the number of people, the sheer number of people across the country, put us in a position in healthcare that we had to come up with criteria for who gets the vaccine first and then next. This age group is a lot smaller, 5 to 11, about 28 million across the country. So here in Wisconsin, this population is far more manageable. And based on what we have been told by DHS, that the vaccine supplies will be coming in to meet the demand. So I don't expect a shortage in the vaccine, but you bring up a good point. How can we make it accessible in communities where there are limited or fewer options for, healthcare in general and vaccine delivery in specific?
Is getting more kids vaccinated, is that the way to unmask the kids? I mean, there's been a lot of talk about mask mandates in schools, and my kids don't mind masks, but I'm sure they'd be happier without them. So if over the course of the next couple of months, is there a threshold where we get enough of these kids vaccinated and we can start to not have to wear masks in school and keep schools open more and all that?
It will certainly help. It will depend on the disease burden in the community. When the spread of the virus declines and most people are vaccinated, then I'm certain that public health authorities will begin to scale back some of these requirements, such as masking, social distancing, the number of people who can be in the same room at the same time. So these guidelines that were put in place for a reason will not be necessary at some point when a large number of people or a large percentage is vaccinated.
Last question for you, very basic question. Is this going to cost parents money to get their kids vaccinated, or is this, as the previous one, covered?
It is covered. It's free. There will be no cost.
Perfect. Anything else you want to mention that I didn't ask about?
I think we covered everything.
Good. All right. Dr. Kharbat, Vice President, Pharmacy Services at SSM Health, thank you so much for bringing this really important information for us today.
My pleasure.
And thank you to Dr. Kharbat again. We'll take a short break. We'll be back with more local news, including a really egregious story from the University of Wisconsin. It's not the University of Wisconsin that was egregious. It was the Howard Hughes Medical Institute. And we'll be back with that story right after this word from Madison College.
Apply yourself. At Madison College, we encourage you to be your truest self. You're a trendsetter. Whether it's the clothes you're wearing, the music you're listening to, or the new game you're playing, you're into it first. Friends and family seek your advice because you're a natural-born leader. For you, life is all about taking things to the next level. And at Madison College, we can't wait to see what you do. Apply yourself today.
All right, today we have the third installment of our most influential Asian Americans, which is on the site right now at Madison365.org. As you can see here, just a glance at these faces, you can see that there's a great deal of variety, of diversity among Asian American people. We have, in Wisconsin, we have a lot of Hmong people, along with Minnesota and California. But everywhere in the United States, there are Chinese Americans, Japanese Americans, South Asians, Indian Americans, Pacific Islanders, Filipinos, and Indonesians, et cetera. And they all have different experiences, right? They all have different backgrounds, different, they've all got their own story of being marginalized and oppressed at various times in history. And that's why we want to highlight them all. And we try to get a good mix of folks in our list. So take a look at our list today and yesterday and the day before that. We got 2 more installments coming in the next 2 days. All great people, 34 people in all that we feel like you should know about. Now, this leads into our next story, which is about a Hmong researcher. Her name is Kaoli Yang. She is a doctoral candidate in neurosciences at the University of Wisconsin, specifically in the Wisconsin Alzheimer's Disease Research Center. She's in that stage of your PhD where you're basically doing a lot of research and writing a dissertation. And the research she's doing is on the factors. I'm going to try to say this in the way that she told me. Is the factors that lead to the loss of neurons in the late stages of Alzheimer's disease. And she's developing new and innovative imaging techniques to aid in that research. She's also getting a master's degree in public policy at the same time, specifically related to working with, getting Alzheimer's disease and other dementia information to marginalized communities, and how those communities are engaged in this sort of brain health stuff, right? So she's getting a doctorate and a master's degree at the same time. She's from Madison. She grew up in the Allied Drive neighborhood and then later in Kennedy Heights. She did her undergrad at UW Stout, where she was a McNair scholar. Now, you will probably be aware that there are very few Hmong people in the like neurosciences, right, or in hard sciences at all. A lot of great Hmong people in Wisconsin doing really good work. We had one, our Woman of Excellence this year in the Community Choice Awards was a Hmong history professor over at UW Milwaukee. We got lots of PhDs in those kind of areas from the Hmong community, but the Hmong community is just really underrepresented in the hard sciences, which Hmong people have really only been in the United States for 45 years, right? They're only on their second generation here, right? So Kao-Li Yang was nominated by the university, and the university identified her as the kind of person who should get this fellowship called the Gilliam Fellowship from the Howard Hughes Medical Institute. This is a fellowship designed for people who are underrepresented in the sciences. So it would make sense that a Hmong scholar would be a good candidate for that. They went through a rigorous process to apply for this thing. First, they had to basically apply to the University of Wisconsin to be nominated, right? Which was she and her advisor, Dr. Barbara Benlin, both had to write 2 different statements to the university explaining her research interests, her training plan, her path, right, over the next 3 years, as well as stuff about diversity and inclusion, about being from a marginalized community, what that brings to the table. So they did all that. The university chose her. The university, the way she said it is my university values me and my contributions to this research, right? So they nominated her to the Howard Hughes Medical Institute, who would not even consider her application because she is Asian. And if you look at the federal data that Howard Hughes Medical Institute uses, the federal data says Asians are actually overrepresented in the sciences. Asian people make up just under 6% of the population in the United States, Asian American, I should say. But about 6.5% of people in graduate programs in the sciences and engineering. So Asian broadly is overrepresented, but it fails to take into account the differing, the heterogeneity, as Dr. Lori Lopez would say it, of Asian people. Dr. Lori Lopez spoke to me for this piece. The article is on Madison365.org right now. You can go take a look at that. She is the chair or the director of the Asian American Studies program, and she's a professor of communication arts at UW. She talked about this as a problem of failing to recognize, as I said, the heterogeneity and of Asian American people and the unique story of oppression among Hmong people. They fled here as refugees 45 years ago with nothing, right? There's no generational wealth in this community, unfortunately, right? And they're just underrepresented. 10% of Asian Americans broadly live in poverty, right? 13% of the overall American population live in poverty. 17% of the Hmong population lives in poverty, right? Something like 24% of Asian Americans have some sort of advanced degree. Only 6% of Hmong people do. And most of those are in like social sciences and stuff, are not represented in these, in like things like neuroscience or biology or chemistry, things like that. So, not sure what to do about it. This is a big fellowship. You'd pay her $36,000 a year for 3 years if she got it, so that she wouldn't have to have another job, right? So she could just focus on her research. But there's it's the model minority myth, right? Where which pits Asian people against other Black and brown folks. This false idea that all Asian Americans are thriving, doing well, and therefore other minorities should be able to follow suit. And it also puts in somebody like Kao-Li's mind that she shouldn't ask for help because she's Asian and she should be doing fine. And she even talked to me about that people have assumed about her that she comes from, if she's Asian, she must come from an affluent family. And she doesn't. She comes from a Hmong family who is refugees, a family of refugees in Allied Drive in Madison. Right? That's not going to be an affluent family. And so she has to make herself vulnerable and explain to people, no, we didn't grow up rich. And, that's not a pleasant experience for anybody. That's not a conversation anybody wants to have. So she's overcome all of that to get that McNair scholarship and for undergrad, and then make it to the graduate school where she's shining as a researcher, really contributing to the field of neuroscience while being a member of a marginalized group, an underrepresented group. And she can't get any help because she's just lumped in with all other Asian Americans by the Howard Hughes Medical Institute. And, I think that should change. I think there's a lot of talk and scholarship about disaggregating Asian American data, right? Separating out different Asian Americans because they're different experiences. They really are. So that story is at Madison365.org. Take a look at that. Share that. Reach out to the HHMI if you want to. If you want to try to make a difference. So again, that story is there on Madison365.org. One other story I mentioned today, also a UW-related story. Dr. Angela Byers-Winston, professor in the UW Department of Medicine. She's also the director of research and evaluation at the UW Center for Women's Health Research, a real leader on the faculty at the medical school, has been named to the National Institute of General Medical Sciences Advisory Council. That's one of the 27 centers and institutes that make up the National Institutes of Health. So she's recognized nationally at the national level as a leader in medical research, and will sit on that advisory council for a 2-year term. And she plans during those 2 years to focus on creating more space for underrepresented groups in the biomedical field. So congratulations to her on that appointment. That's her. All right, that's all the news I have for you today. If you value what we do here, if you value this information, this news, please consider joining the fam. If you join the fam right now, you can make more impact, because if you join the fam at $5 a month, Newsmatch, which is funded by Institute for Nonprofit News, will match your entire year's commitment. Right, so you go to Madison365.org/the fam. You join the fam at $5 a month. Newsmatch gives us another $60. You join at $10 a month, it gives us another $120. So basically, your entire commitment is doubled if you sign up for the fam right now, between now and the end of the year. We'll talk more about that next week, I'm sure. I'm going to make that pitch to you lots of times, because it's important that our news remain free for everybody to read and to watch and to listen to, but it's not free for us to produce, right? We pay professional journalists to do this work, and we need your help to do that. So go to Madison365.org/the fam and join up today. All right. I will be back tomorrow with more news for you, and you can always keep up at Madison365.org or the Facebook page or Twitter or Instagram. I will have the podcast in the morning. Until then, take care. We'll see you soon.
This is 365 Media.